Hello, I'm Dr. Kanwaldeep Mallhi. I'm a pediatric hematologist oncologist and the clinical director of the BMT Cellular Therapy program here at Roswell Park Comprehensive Cancer Center. So I went to medical school at Roswell Franklin University. It's Chicago Medical School. And then I went on and actually did my pediatric residency here at the University of Buffalo. And then went across the country and did my pediatric hematology oncology fellowship at the University of British Columbia, and then a second fellowship in bone marrow transplant, specifically at the University of Minnesota. There's a lot of things about patient care that I really enjoyed during my medical school experience, but initially I think it started off just being me as a patient myself, seeing the interactions that I had with my doctors in my life and my family's life, and that just drew me to something that I knew I could do and that I wanted to be part of. My specialty really came to me during my pediatric residency. I always really enjoyed biology and science and innovative research. And I just found that in pediatric hematology, there were so many aspects of research and biology and then just patient care that I absolutely loved. It was a field that was ever-changing and really trying to cure and help these patients who have such devastating disorders, and that's just what drew me to it. I joined Roswell Park because of all the innovative research and patient care advocacy that's going on here at the center. There's a huge push to try new cellular therapies and gene therapies for patients, both on the adult and pediatric side, which I'm very passionate about. And then I realized how much the institution really reaches out to the patients and getting advocacy for them and resources for them. And I knew it was a patient population that I could help, and I wanted to be part of that mission. This is a great program. It's a nice balance of just oncology for our pediatric patients, but also for the hematology and the non-malignant disorders, which is what I actually like to focus on. There's a huge patient support from nursing and our staff and the doctors to take care of a vast variety of pediatric disorders. And obviously my goal is to hopefully try to cure those long-term with cellular therapies. And so I think we just have a great budding program here for families to really get the care that they need. There's a lot of exciting things happening in cellular therapy. I think, the focus has really been on trying to cure cancer, but also to cure disorders that have other implications lifelong, like hemoglobinopathy, sickle cell, and thalassemia, and also some primary immunodeficiencies. The research and the innovation within the field is expanding every single day. I think there's a lot of work being done to help our patients be cured of these disorders, and I want to be part of that. It's the patients. The patients are what drives me here to work every single day. They're going through such challenging experiences in their life, both their families and the patient themselves. And I just want to be a part of that to help alleviate some of that difficulty that they're going through and hopefully cure some of the disorders that these patients are experiencing.